Hi, I'm Dr. Robert Hirten. I'm an associate professor of medicine and artificial intelligence at Mount Sinai Hospital. And we're currently at the New Wave in AI Healthcare Conference at the New York Academy of Science. And I have the pleasure of introducing and interviewing Dr. Rumi Chunara, who's an associate professor at NYU and directs the Center for Health Data Science. And she just participated on a great panel discussion discussing diversity in data, particularly in artificial intelligence. And I'm very happy to have her here now to discuss a little bit of her work
Yeah,
and some of
thank
these
you. Thanks for
topics.
having me.
So, just to start out with, what is really a topic, really, tool or technology that you think we should be paying more attention to, but tends to be overlooked in research now?
Sure. So, I guess one of my passions is thinking about health holistically. And so, of course, there's a lot of good work happening in healthcare systems, in hospitals, a lot of structured data is there, which is naturally amenable for analyses and AI development. But we all know there's a lot that shapes our health before we even get to the hospital. So, I would say one of the things that I think is understudied is the role or how we actually link all of those factors from outside the hospital. Things like people might have heard of the phrase of social determinants, environmental aspects. And so, all of these aspects, we can start to think about them in terms of bringing them into that data conversation as well. But it's going to be challenging.
Yeah, and you mentioned social determinants of health, which there's a lot of interest in, and rightfully so, in how we could evaluate these. What are some of really the new analytical methods you're using to look at these, and what are some approaches we could kind of use to delve into the topic more?
Yeah, so you're absolutely right because those factors are often are constantly occurring, or they might impact whatever outcomes we're looking at, kind of not as proximally as closely. It means that there's more statistical challenges. So we are looking at, I would say, kind of in a few ways. One is even measuring those factors, right? Because they're not in a healthcare like electronic health
Right.
record, they're not in a structured manner. How do we capture those? Just kind of, that's a broad question. And then how do we also develop the analytics to link those things together, right? How do we statistically model that? What are the important time periods and or spatial granularity? So a lot of statistical questions.
And I particularly like some of the research, or I found it very interesting how you've used social media and ways of exploring social media in evaluating some of these challenging questions. And social media is everywhere, everyone is on it, so there's a wealth of data, I would imagine, there. So it'd be great if you could sort of elaborate a little on how you've been exploring this in some novel ways.
Sure. Yeah. On the one hand, we have been looking at social media for many years now, as a way to get the pulse on some of those out of hospital factors, like things that happen culturally or just in different spaces. At the same time, social media is changing a lot, so that brings other challenges. But it is true that a lot of our lives are kind of spent online now,
Right.
right? So
Yeah.
whether that's just on websites, but also on social media platforms, and so those are other experiences and exposures that we're generating, and they're also going to affect us. So that's some work that like I mentioned, we've been doing it for years. It's been we have a new big study also looking at basically how cultural sentiment around discrimination factors like race based or sexual orientation based, how do we know they affect our health, but how do they really get under the skin? So we're trying to capture that whole pathway from what we're being exposed to, by using things like natural language processing, also like spatial statistics, and then linking that with other factors that we know about people to kind of see that whole chain of events.
And I think if we're talking about that line of reasoning too, where do you really see the future going in all of this? As far as which area of research utilizing AI are you most excited about? And is it in these areas, exploring these areas of social media and these new data sources, or how would you kind of look at that?
Yeah, so while I'm a data person, I also love the fact that the people working with data together. And I feel like that's, as a professor, that's been one of the most satisfying parts is seeing um, different students coming from different areas come together. And so I feel like what I'm most excited about is actually this kind of language that we're all coming together on, and whether that's to develop new studies, new amazing findings, or to just be able to spend some time together and look at things in different ways. So I actually like that this is an area that we can come together on.
Oh, nice. Well, thank you very much. Thanks for joining the panel today here and for spending the extra time talking to us. And look forward to hearing more and about your work and seeing what the future brings with it.
Thanks for
Exciting
having
work.
me.
Thank you.